Hi everybody, this is Rhys Barber from Audiology Associates. Thanks very much for watching our earwax removal video today. Just one patient in this video today. Guys, if you do hear a little bit of noise in the background, we've actually got a training session running in the room next door today, so you might hear some of that noise spilling through. But you can see this is a really difficult one to do. Now, there's a lot of movement in this particular patient. Now, this patient did have a slight tremor, which makes it a little bit more difficult when we're doing these types of removals. But what we can see in here is a really unusual consistency of wax, this one. So we are literally just inside the ear canal here. So in that lateral portion of the ear canal, this is the standard size ulnar tube, just so you know what we're using here as well. So you can see it's quite a wide old canal. But what we have here is this really thick layer. Now on first glance it looks like quite sort of bobbly wax, but it's not. This is actually layers of skin. Now we've seen us talk about keratosis obturans and conditions like that. It's conditions where we get these skin layers peeling away and forming these really solid plugs. Now this is almost a precursor to that. You're seeing the sort of not quite got to that stage, but almost there. But look to see how these layers come away. Now when we talk about conditions like keratosis obturans and certainly these kind of conditions here, I want you to imagine an onion and taking a slice straight down the center of an onion, and those layers that we have in here, that's how the skin forms. And that's because it's coming away, those epithelial skin cell layers are coming away off the canal wall and coming away in layers like that. And that's what's happening in this particular patient. Now, sometimes that can be triggered by things like infection, trauma to the ear canal, lots of different reasons that can be going on in here. But this particular patient, you can see this is really thick old stuff. Now, it tends to be really tough because each layer is attached to the layer underneath. So I want you to imagine almost like a concertina effect. When you start to pull this out, the layers almost sort of stretch out. Like you used to make paper fans when you were kids, and you kind of unfold them like that. That's what I want you to imagine this to look like. And we've just got a good old grip on here. Now, the difficulty is because they hold together really tightly, they don't always want to come apart really easily, and the suction doesn't always have enough grip. So you see me doing these lots of wiggly motions here, and that's me detaching it from all those layers underneath as it's coming away here. There we are, we're just starting to lift the neck so you can actually see where it peels away from the canal wall. So you can see how those layers are coming apart there. There you go. Look how it goes all the way down the canal as well. This is a long old extraction. Make sure you stay tuned for the ruler shot at the end. I'm not going to spoil it for you now. I know I usually do, but I'm not going to spoil it for you now. But I want you to take a look at the ruler shot at the end because it is such a huge amount, because it's actually both the ear canals look exactly the same as this. See how it peels off on your my left, your right. See how it peels off on that right hand section there. You can really see it coming away. Don't forget, guys, if you do enjoy these videos, and if you don't mind, we would really appreciate it if you could like, follow, subscribe, heart, oh my goodness, all those different things. That would be absolutely fantastic. We really love getting new subscribers. And if you've got any queries, pop them into the comment section. I know I don't respond in the comments, guys. It's so busy and I get very little time outside of clinical hours, unfortunately, and most of that's taken up with the edits. But if you do have a question, I do read them. I tend to come in the morning, have a quick glance through the comments, and if there's something in there I think you guys really want to know the answer to, we'll pop it into one of the videos for you. So there we go, you can see it coming away. Look how it's not floppy, it's really sort of tough skin, but look how this is going all the way, right the way down the ear canal here. So down this edge, there's actually a piece that's stuck right at the bottom of the eardrum here as well. You can really see how this forms. Remember, go back to what we were talking through over the last couple of weeks about the tympanic membrane having these different layers in different parts of the membrane, but always across that surface, or the lateral portion of the tympanic membrane, you've got that epithelial layer that forms the canal wall skin. Look, and that's what I mean by that. Do you see it peeling away from the tympanic membrane to that outer portion of the ear canal? So basically this is all starting very deep. It's starting right at source, right down there, and look, can you see how it peels away? It's coming away in very thin layers here. So we're just going to get this last little bit off this side here. Very wet wax. Now, don't forget, we do advise our patients to put a little bit of olive oil in before they come along. And a lot of the time, olive oil gravity is going to pull it down to its lowest point. Now that's right at the base of the canal. So the skin down at the bottom does tend to be a little bit sort of wetter, and that's what we're seeing here. There's this much wetter, looser, more floppy skin material. They've got to be a little bit more difficult, you haven't got to be difficult at all. You've got to be a little bit more careful when you get this wet. See how that skin looks at the base of the canal, that very wet skin? Look what happens when we start to lift it. You can see there's a very, very pink skin underneath. Now that's the fresher layer of skin. Now you've got to be really careful there, because when you're lifting that soft layer of skin away, when you come across that pinker layer underneath, that's very, very sort of, not new skin, but it's the base layers underneath, and that's really close to the blood vessels. So you've got to be careful you don't end up with a little bit of bleeding there. Bleeding in the ear canals, I mean, it sounds horrendous, but what you get with when you're doing extraction, sometimes you will get a little bit of bleeding, okay? It's not uncommon, and that's because the blood vessels are so close to the skin, the epithelial layer is so thin that it's quite easy to scrape, and then the blood vessels are literally just below the surface, and then that's going to cause a little bleed. If it does, most of the time it'll bleed for about a minute and then stop, and then you're absolutely fine. If it carried on, what we can do is we can pop a little sponge just inside here. It's called basically we use it like a tamponade. So basically what you're doing is you're pressing against the side of the canal walls, and that's going to stop that blood flow coming through. But most of the time it just stops by itself after a couple of seconds. So we just got this little bit at the base of the tympanic membrane here. We're just working very low. You can see it makes it a little bit more difficult with this patient's tremor. You know, we are very, very close to the tympanic membrane there. And with the tremor, we've got to be really, really careful. Now, I wouldn't entertain the idea of doing something like an eardrum peel on a patient with a tremor. It's just too risky. You know, we have got quite a solid tube inside the ear canal. And well, you can see there the patient moved again, that little tremor. So I'm not going to do a skin peel or an eardrum peel on a patient like that. It's just too risky. You could cause too much damage. So we're just clearing up the outside edge now. There we go. Just so you know, guys, I think tomorrow I am back with the always lovely Mr. Taylor Green, and we're doing our voiceover together. I think you're going to see him a couple of times this week. I think we've got a few sessions. So this is what it looked like beforehand, and this is what it looks like afterwards. You can see a very, very different ear canal there. We've got exactly the same problem on the other side. So we're straight in here now. Let's start lifting. You can see the consistency of this outer layer. Now, cast your mind back literally 30 seconds to what that skin looked like when we got into that deeper section. It's fresher formed skin. It's new, it's soft, it's floppy. It looks the way we expect skin to look. And then when it gets to this outer section, when it's moved, it's migrated out to this more lateral section of the ear canal. What we've got then is, remember I told you about keratin that's in these epithelial cells? Obviously, this keratin is causing those cells to harden. And what we've got then is this really tough material on the outer part of the ear canal. Don't forget, keratin is what your hair and nails are made of. So you can imagine how tough this is. Now, the difficulty with this type of problem is if you leave it go unchecked, if you don't get the patient's ear canal cleaned out, it can actually start to degrade the canal wall skin, which is what you saw at the entrance, the lateral portion of the ear canal on the last ear canal there, where it had gone very soft with that pink layer underneath. Just a bit of an aside, patient didn't even feel they had any difficulties in this ear canal at all. They only came in to have the one cleared out because they were only experiencing issues on the one ear canal. But look at this. We get this question all the time in the comments. How did this patient not know it was this blocked up? Because if there's gaps around it, the sound can get through. So you don't always know. You can see just how tough this is. This is the fine jaw forceps we've got in here. And it's just not budging it. So we're going to go over now with the Jobson horn. I need to break this surface layer. Remember I told you in the beginning part of the video, like an onion and all those layers are connected to one another. That's exactly what's going on in here. So we've got to try and detach these individual layers from this onion. And that's what we're doing here. We're just pulling, there you go. That's one of the layers there. You can see just working its way out. See how it's connected it as you pull it through, it's pulling that next section out with it as well. So it's really coming away very nicely here. Let's give it a bit more of a wiggle. There we go, out that comes. And we've just got a little tail left in there of the section we were just pulling. So that's the bit we're going to work on next. We're going to try and bunch as much of this into the suction tube as we possibly can. And what that's going to do, it's going to help to maintain that suction grip on this particular piece of wax. Skin, sorry, wax / skin. There you go. So it is a mixture of both. So it's coming away really, really well. And we're not, don't forget, we're not in the ear canal at all here. We're still in the bowl of the ear, which is the outer part of your ear. This part of your ear here, just for you to know, is called your pinna. I'll put the word up on the screen now. So that's your pinna. What we're working in here is this little bowl here, basically, of the ear. This is known as the bowl down here. So basically, we're working in that section. We're literally just popping in to the actual canal itself, just to get these bits. Now, we'll have to go in a little bit further. See, when we pulled this section, it didn't bring the next section forward. So we're going to have to go in now just that little bit further. So we're using the side of the suction tube here just to move the outer portion of the ear canal just out a little bit. Don't forget, stay tuned for the ruler shot at the end, guys. It is huge at the end. But we've got a good grip on this next section. Look how that is coming away there. Look at that peel. It's almost unfolding. We're having to move the suction tube further forward to get a better grip. But look at that coming away. That is a big chunk of skin and wax there. Let's have a look behind it. Are we starting to win this battle? Yes, we are. We can see a little bit of light at the end of the tunnel. Now, we do have a section that's sitting at the top of the canal, and there's also a section at the bottom of the canal which needs removing. So we're just going to work those two bits out. Look at the difference in skin. Look just beyond the top of the suction tube, and you'll see it almost looks grey, going much further back into the canal there. And that's that layer. Remember that conveyor belt mechanism for the skin we've gone over in a few videos now? That's that skin layer going from that more deeper osseous medial portion of the ear canal to the lateral portion of the outer end there. So it's coming away really well. There we go. Look how this is unfolding. It's always the same. It's always deceptive, these particular types of removals. That is fresher skin. Look at the consistency. It looks floppier. It looks a slightly different color. It looks very different in that section. You can actually see it peeling away just there. So in that innermost portion of the ear canal. Now, I'm going to put it out there before we get to this next bit. I'm pretty sure I leave a hair behind in this one. Yeah, I'm almost sure I do. Before you all jump on the comment section, don't forget what I told you about this patient's tremor, okay? It's if I feel I can get something out safely without causing any issues, of course I will do that. If I feel that there's going to be an issue getting this out, or it's going to put the patient at risk of causing damage in their ear canal, I will leave it alone, okay? And with the tremor, and where this hair was lying, was right down on top of the eardrum, was bent up on top of the eardrum. I'd have to go in there with a forceps to get that out. It's not worth the risk. It's not worth the risk. This will come out, patient's next bath or shower. We inadvertently get a bit of water in our ears anyway. It's going to flush this out. So you can see I'm just switching down to the fine end here just to get these little bits out. There you go, just working my way. Using that motion where we drop over the top of the skin and draw backwards to pull this out. Guys, as I said earlier, don't forget, if you do enjoy these videos, heart, like, share, subscribe, follow, all of those things. That'd be absolutely fantastic. Thank you very much. There you go. There's that hair we were talking about. So I did leave that behind, but with the tremor, it's not worth doing. It's not worth doing. So I told you to stay tuned for the ruler shot, didn't I? Look at that. Shit, my goodness. What's that? 9.5 centimeters. I might even go to say it's just under 10. Go on. Well, a little bit. It's like a fisherman's tail. It was just under 10 centimeters worth of skin wax. But look at all of that coming out. Oh, shit, I forgot to do the inches. 10 centimeters. Oh my goodness. I'm going to go with about 4 inches or just under. I think that is, if my maths is about right. So just under 4 inches, 10 centimeters, or just under 10 centimeters worth of skin and wax. Guys, I know you enjoyed that one because you love a good skin peel, and anything with these huge amounts coming out, you love all that stuff. But as always, guys, take care of yourselves, take care of your ears, and take care of one another. As I said, I think I'm with a lovely Taylor Green tomorrow, and then I shall see you again towards the end of the week. Bye, everyone.